doing our first live broadcast, which is kind of cool. We're excited about it. It's our first time doing it, so bear with us. It should be great. We're going to be very informative. Looks like we got like 80 or 90 people on this call, which is really, really cool. So lots of people. We're going to give you a lot of information today, and what we're going to be talking about is implants. So, but at Burns Dentistry, we think it's super important to understand all your options. And so we'll be going over a lot of different information here. We've called this program Change Your Smile, Change Your Life. We feel very strongly about that because the majority of our patients, when they go down doing some life-changing dentistry, implants, changing their smiles, it does change their life. It changes, they're able to chew better, they're able to smile with confidence, and you'll kind of see some of that in this program. So it's exciting, we're really excited, so let's get going. Burns Dentistry, we have 6 doctors now. This is a picture of 5 of us. 6 doctors, we're all general dentists. Each one of us has kind of a passion for different aspects of dentistry. We provide every aspect of dentistry under one roof. So we can do everything from cleanings to fillings to dentures to implants to surgical procedures, Invisalign. We do it all. So we're really happy about that. Our patients really enjoy that they don't have to go to other offices to get other procedures done. Everything can be done under one roof. We have 2 different locations you saw previously here, one in Sun City and one in Sun City West. The information seminar is to give you the information. We think and we feel very strongly about you knowing all your options, that you know your mouth very thoroughly so you can make the right decisions for yourself. So we do not feel that everybody is cookie cutter, one size fits all. That's just not the case. So we want you to know the state of your given circumstances and what all your options are so you can make the right decision for you. And that's why this seminar is so important. So let's jump right into dental implants and what is a dental implant. Dental implant is a titanium piece. There are some new materials coming out on the market, but the titanium is the mainstay. And it mimics the tooth shape. So, and you can see in this slide, you have a tooth on one side and the implant on the other. And the actual implant with the crown portion that goes on top really mimics what you're seeing on the left is your natural tooth. And that's why it works so well. Now, we've been using titanium for a long time in the medical community, and actually in the dental community, we've been using it now for 30 years or more. And so the science behind it is there. The success history is there. It's just the best way to replace a missing tooth. It's not anything new. This is an actual photo of an Egyptian mandible, and you can see a couple of those teeth in there are actually shells. And so they actually embedded shells into the jaw. So they were the first, or at least what we have record of, the first implants that were being used. Now, of course, the materials are a lot better today than they were back then, but you can see that there was some experimentation going on and actually success, it looks like. In the 1980s, dental implants became a little more popular in the dental community, and it's just gotten better and better and better. The technology, the materials, everything since then. It was pretty limited at first because of the cost. Not too many people could afford dental implants, and so it was really limited to the rich and famous. I don't know if you can tell who this is, but you can see his smile and life were drastically changed by dental implants or changing his teeth and his smile. You're going to see throughout this that there's a couple different situations that occur when you lose teeth, and it's really important to act quickly. The longer you wait, the more problems that there is, the less bone we'll have. There's just no better time than the present, right now, to get these things taken care of. So, acting quickly is going to be super important, and keep the cost down. It keeps the time down. It keeps the amount of work that we need to do way down. So a couple of things we're going to go over with in this. The consequences of losing your teeth, like what actually happens. A lot of people don't have any idea what the benefits of dental implants are. But like I said, we're also going to go over what other options are available. And we're going to do that in different categories so you can kind of see and you can actually look at it from your perspective and kind of know, okay, here's my options. This is what dentistry can do for me. And also, how can you claim your smile back? Your smile is obviously has some social and emotionally things that it does for us. It gives us incredible confidence. It allows us to engage others. Our smile is usually the first thing that people notice about an individual. So it's super, super important. There's also the whole physiological aspect of it, and having teeth and being able to chew properly, we'll get into a little bit more, and getting the right nutrients. So missing teeth really jeopardizes all of that. So it's super important that we have teeth. So we put this on because we hear all the time really four main things that you see listed here, and the biggest one that we see, and probably the one that's growing year after year, is that clients are tired of dealing with the breakdown and the disease that keeps reoccurring in their mouths over time. And what I mean by that is that, people will do crowns, they'll do fillings, they'll get gum disease, they'll get it corrected, and then a couple years later, they're dealing with it again. And as we get older, as we age, as our diets change, as things change with our physiology, then it also affects our mouths. And so we start to see cavities coming back more and more as we get older. We start to see breakdown with the teeth occurring more. We start to see reoccurring of periodontal disease. And a lot of times people just get tired of spending the money. Of course, it's expensive, but also the time and energy coming to the dentist and having work done over and over and over again. And so that's kind of the big one that we're seeing more recently, that they're just tired of dealing with it and they want a more permanent solution with less maintenance, something they don't have to worry about cavities over and over again, and they can go and enjoy the rest of their lives and not have to worry about the dental aspect of it. Of course, they can't eat. That's another big concern. They can't chew the foods that they want to chew. They can't enjoy the foods they want to chew. And then on top of that, then we talked about earlier, the nutritional aspect that's totally missing when you don't have teeth. They're embarrassed. That's another big one. It's the top three. They're just embarrassed of their smile. For years, they've had a smile that they're uncomfortable with, that they feel like they can't smile in public. They can't communicate how they want to communicate. And so, fixing teeth, replacing teeth is a life-changing experience because they're embarrassed. And then they don't know where to start. And so that's the other one, is that they just don't know where to start. They don't know what questions to ask. They don't know what their options are. And that's why we brought this to you guys today, is so that you would know, hey, here's my options, and here's kind of the steps that go along with that, and here's how you start the whole process. So what happens when you lose teeth? And now we're going to talk about single tooth loss, we're going to talk about multiple tooth loss, and we're going to talk about all the teeth loss. So there's three different areas that we'll be covering today. But the key thing is to keep in mind is that when you lose teeth, you lose bone. You lose about 50% or up to 50% within the first 6 months alone once you've lost that teeth. Now, if you're losing multiple teeth in the area, that number actually goes up, okay? And then over the next months and years after that, if there's nothing in the bone to stimulate it, like teeth or implants, then that bone continues to melt away. So as we get older, it continues to melt away faster. Unfortunately, in women, we tend to see it going faster than men, but as we age and while we don't have anything in stimulating that bone, it melts away even faster. There's also studies out now that show that if you put a denture or a partial denture, which we'll go over here in a little bit, on top of that bone, then you actually speed up that bone loss. So that does a lot of things. It causes what we call facial collapse. You can see in the pictures here of the lady with teeth, with no teeth immediately, and then after her jaw starts to melt away, what that actually does to the face. The age doesn't change, it's just the structures change because of the lack of bone. We can end up with getting pain. Once you start losing bone, there's nerves inside those jaw bones, and once those nerves start getting encroached upon, we will tend to see that we're having more pain with dentures, with partials, etc. This is an x-ray. I'll move my mouse around here quickly just so you can see, but the top line here represents where the top of the jaw is. Now this is the left side of this person's missing teeth right here. The jawbone used to be where this dotted line was, And over time, it's melted away down here. This other line represents where the nerve was, I'm sorry, where the nerve is currently. And so this patient was complaining with their partial of getting a lot of pain. Well, the problem is that it's encroaching on that nerve, and so it's pushing on that nerve and causing that nerve pain. This is a CT scan, or a three-dimensional scan, taken in the office. And what we're looking at here is highlighted in that yellow box. If you look closely at that jaw, you'll see that troughing that's occurring in the jaw. That troughing is where the nerve actually is. And again, this person had a denture and was in a lot of pain with the denture, because the denture is pressing down on top of that nerve. So as they're chewing and eating, they're just getting constant pain. And you can see it on both sides there. Mayo did a study, and this is a really cool study, that they took people with partials or dentures and how they chewed in relation to people with teeth. And you get a decrease in the efficiency of 50%. So this is huge. And what that really translates to is that because you're not able to eat the hard, crunchy vegetables and foods that we should be eating, we tend to veer then towards a softer diet. The softer diet, more starches, more carbs, more of the things that don't give us the nutritional value that we need and our body needs. And so not only are we not chewing efficiently, not only are we not allowed to chew all the foods that we want to eat, but we're not getting the nutritional value that we need in our bodies. We're also not able to digest the food properly because we're not chewing it properly. So if you're not digesting the food properly, you're not getting the nutritional value that you need. You can see where we get a big problem when we're missing teeth. So let's go over the options. And I will say before we start, and this shows here that implants now in dentistry are the standard of care. So, 20, 30 years, they weren't the standard of care because there was some uncertainty with them. But now, if you're missing a tooth or teeth or all your teeth, implants are now the standard by which we hold everything else to. So that's really important to know. And the reason for that is what we discussed earlier. They mirror the exact tooth. They preserve bone. They protect the adjacent teeth. They keep things from moving. They don't get cavities. The list goes on, and we'll kind of go over that in this seminar. The success rate of implants is phenomenal, 98% after 10 years. It's the most successful thing that we can do in dentistry today. Again, we've been using titanium in the medical community. You may know people with artificial knees or hips. It's the same type of material, shoulders, the same type of material that you're using with the teeth. And the reason we use it is because it's so successful. So the three areas that we're going to be looking at today, a single tooth, if you're missing one tooth, if you're missing multiple teeth, or if you're missing or going to be missing all of your teeth. And what I mean by that is going back to sometimes people have some teeth but are deciding to get rid of them for other reasons. So one tooth. In this photo before and after, you can see a client broke a tooth, a side tooth there, and what it looked like with the implant option. But we're going to actually walk through now all the options for a single tooth. So and these are all in order of the easiest and probably the cheapest moving up. The first option when you're missing a single tooth is what we would call a flipper or a partial denture. It's the most economical. It can be done pretty quickly. Within a week or two, we can have this done. And it snaps into place. It has those little clasps that you see that kind of grab onto teeth. It really is what we would call here in Burns Dentistry a party tooth. And what I mean by a party tooth is that you wear it when you're at a party. You wear it for social interactions. It's really not meant for functioning. It's not meant to be chewing, biting into things with, it will break. It's designed with plastic, so it's not the ideal long-term situation. We would use this a lot of times in a healing situation. We take a tooth out and we're waiting for things to heal. We placed an implant, we're waiting for things to heal because it is very temporary. It moves around, it breaks pretty easily. You still will lose bone if you haven't placed an implant in there. It does have to come out in and out every time you eat, so you can clean underneath it and around it. It's really a temporary option. The next option would be a bridge. This was the standard for a long time before implants came in. And a bridge is where we would adjust the adjacent teeth. And you can see in this photo where the two teeth that we're getting ready to put that bridge down on have been ground down. And that's probably the one, or the biggest con about a bridge is the fact that we have to do something to the adjacent teeth. The pro of this, though, usually can be done pretty quickly. Within a week or two, it's fixed. It cements down over the top of those teeth, so you don't have to worry about it coming in and out. But we do have to grind on the adjacent teeth. You won't be able to floss through this. So this is one of the cons of this, is not being able to floss like regular teeth. You have to get underneath it, which is the main reason why these fail. You can get food trapped underneath there. You will continue to lose bone. But the biggest thing is that we do have to grind on those teeth. And anytime you start messing with teeth, especially if the teeth don't need to be messed with, you can cause other problems. The success rate of these is about 10 years on average. That's kind of what we see here. And usually the reason for that 10 years is that because you get cavities on those teeth that it fits on, you get breakdown, you get gum disease, and the bridge fails, and you have to go on to something else. So that is what we would call a fixed bridge. And then, of course, you have the single implant. The beauty of this is natural looking. It will probably be the strongest tooth in your mouth. It stops bone loss. We don't have to do anything to the adjacent teeth. We can leave those alone. We're not going to get cavities with this. So, that's one of the huge benefits of implants. It's the most secure, stable, longest lasting option that we have in dentistry, is the implant. Once it's in there, there is some maintenance that goes with it, just like the rest of your teeth, but it should last you the rest of your life as long as you're taking care of it. The con with these in the past is usually time and money, and they're usually more of an investment. Now, we will be talking about that at Burns Dentistry. We've really drastically invested in technology and material that we can do these and do this service and provide the restoration of the crowns and stuff on there to really reduce fees. So we're bringing the cost down, so the cost will mimic more like the fixed bridge that I showed you earlier. So, not only is it better, but it's going to cost about the same anyway, so it's just a better alternative to do. So we're really trying to take the cost out of it. It does take longer. It is the longest thing to do, so that's probably the biggest one. If you're in a hurry, this might not be the right scenario for you. So here's a before and after case just to give you an idea. This front tooth to your left is, the front tooth to your left is the tooth that has a root fracture and is going to be removed. She broke the root of the tooth. She also didn't like the color of her teeth, both top and bottom. So as we were going to do the implant option, she wanted to have some options to restore her smile. So in this particular case, what you're going to see is an implant in the one tooth. We're going to veneer and restore the other tooth to give her the smile that she desires. Here's an x-ray of that tooth that was removed and the implant that's in place. You can also see at the pointer right there where the abutment is, and then the crown. And then here is the after. So you can see that the implant is healed perfectly. We have beautiful crowns and veneers on her teeth. It looks just like every other tooth in her mouth, and it turned out fantastic. There's her smile. So this is a case where not having a tooth or any of the other options in this particular scenario would not give us this incredible result that we can get with the implant. Okay, so that was one tooth. Now we're going to shift gears and kind of go into missing multiple teeth. Obviously, we have the picture on the left where we're missing a lot of teeth, a lot of breakdown, and how we can fix that and get those options. Again, another x-ray, this is called a pano x-ray, gives us a big view of the upper and lower jaws and the teeth. So you can see some teeth in there that look pretty good, and some teeth in there that the short ones that are broken down, some infections. So this would be a case where we're going to remove some teeth, but keeping some teeth. Classically, a partial denture. You may have heard it as a partial denture. You may have heard it as a removable bridge. But a partial denture is good because it is inexpensive, and it's also pretty quick. Usually 3 to 4 weeks, you can have one of these fabricated. With one partial denture, you can replace a lot of teeth. So, that's why it's attractive, the cost usually, and because you can do more with one single piece. The downfall of this, though, is there's multiple, but the biggest ones are it's removable. It does have to come in and out. Where you're missing teeth, where you have the fake teeth, the plastic teeth, you will continue to lose bone. Um, but the biggest one, and the one that most people are not aware about and they need to be aware about, is where the partial grabs onto those teeth. And in this photo, you can see those little arms coming up and resting and grabbing onto those teeth. That's how it clamps in. That those clamps put forces on teeth that the teeth weren't meant to take. If you think of teeth like a fence post, fence posts and teeth were meant to have the force going down the long axis of the tooth. These arms and these clasps take these fence posts, and as you're chewing and eating, they're wiggling them back and forth. Well, just like a fence post, if you wiggle it enough, ultimately, you can just lift it right out. The long-term success rate with the ADA says about 5 years with these teeth, and you'll end up having problems with these teeth. So, I want to make sure our clients know that we can do partial dentures, but it may be a short-term solution in the fact that the teeth that it grabs onto today may not be there in a couple of years, and now we have to do something else. Again, continued bone loss, and sometimes an aesthetic concern is that the clasps that grab onto those teeth are visible when you smile and talk. When we're talking about implants with missing teeth, what we can do is what we call an implant bridge, where we're not replacing every tooth that's missing with an implant, but maybe every other tooth or maybe every double teeth that are missing. So we would put 2 implants in, and 3 to 4 teeth would be replaced in that area with the implants. So you get the benefits of a single implant, meaning the strength, the durability, the no cavities, preserve of bone. It'll be the strongest area in your mouth, be able to eat whatever you want. It looks completely natural. Really the only downfall with this is time again, and again, increased fees. Again, because of some of the things that we're doing here at Burns Dentistry, we're able to bring those fees down to make it more realistic and more reasonable compared to the other options. So here's another case, an actual client that we did where in this area where you're going to be missing teeth, those teeth that you can see that are black and discolored are going to be removed, and we're going to be replacing on the right side, the left side of your screen, you'll be doing a bridge and a single implant on the other side. So you can see once we restored the whole mouth, restored all the teeth with crowns and bridge, you can see how that looks. It looks like it's brand new, like it was never changed. Here's another arch. This is a lower arch, and again, we're going to be doing a bridge on the lower right and the lower left. And here's the after, where in both of those areas, those are implant bridges replacing the teeth that we had to remove. Here's a before and after case, also restored with the implants and implant bridges. Okay, we're going to jump to next. When we're missing all your teeth. Now keep in mind, this x-ray here shows no teeth. We have upper jaw, lower jaws. This is kind of weird if you haven't seen one of these before, but this is kind of having the jaws kind of laid out. And we use this a lot for diagnostic purposes and the planning purposes. This particular x-ray shows a client of ours with no teeth on tops and bottom. Now, missing all of your teeth, and the options that we're going to give also go towards those individuals who are just tired of dealing with teeth and have decided that they want to get them out and do something else. So dentures, we've all heard of dentures, and there's a lot of reasons why these are problematic that we'll get into. We could probably have a whole series, a lecture on all the problems that we have with dentures. And if you're one of those lucky ones that have them and are not having issues, consider yourself very lucky, because you are the unicorn. You're not the norm, for sure. So dentures, really the only pros is they're cheap. Sometimes they can take a while to get processed. If they're done correctly, they usually will take 4 to 6 to 8 weeks before they're done, if they're done correctly. But the cons, again, the list is a mile long. We've highlighted some of the key ones here, so you can see the biggest ones that we're seeing now or we're seeing a huge increase in dry mouth, which is a whole nother seminar talking about cavities and the breakdown that dry mouth causes. But dry mouth really hurts us when we're denture wearers, because dentures need moisture in order to get suction. So the upper denture especially fits via suction. So on the hard palate, you put the denture, you have moisture in between, and you get a good seal where you get some good suction. If you have dry mouth, that seal is not going to be there. And so not only do we not have it fit very well, it won't stay in very well, but it becomes very uncomfortable because the acrylic is rubbing against dry tissue. But we also have the issue of severe bone loss with these. As we get older, they have to be relined over and over and over and over again, every time making it more challenging, every time making it harder to fit. We get breakdown and wear of these. We get food underneath them. We get mobility. We get them jumping out when you're talking, when you're laughing, or when you're eating, or they're moving out or jumping out of your mouth. We get instances where you have to use that gooey adhesive to try to keep them in. There's just a lot of problems. And again, there's even more. They can make you look older. You can get the clicking sounds when you're chewing and talking. So again, dentures are there. They've been around for a long time. They're not going to be going anywhere. We're seeing less and less and less of them over the years as clients decide to do something else more permanent, something that'll preserve the integrity of the bone, etc. The next step up with that is what we would call an overdenture. Sometimes you may have heard it as a snap denture. And what this concept is where we go in, it's kind of introductory level for implants, where you might do 2 to 4 implants, depending on whether it's the top or the bottom. And on the implants, and then your denture would actually snap on. So we've taken a regular denture, added a couple implants, and now we get this retention effect where it can come on and off. So we get a little bit more stability with this, although it still does move. You still will get food underneath them. They still are removable. You need to take them on and off to clean, and clean around your implants and clean underneath the dentures. But it does make them more comfortable. You don't have to worry about the embarrassment of them jumping out when you're eating, talking, laughing, etc. If you have dentures now, a lot of times we can take your existing denture, as long as it's fitting well and the bite's right, and we can just add the implants and snap it onto the implants. The cons, again, removable, and the bone loss, it only occurs in the areas where the implants are. So in this particular case, the large amount of your lower jaw is not going to have any implants. You'll continue to lose bone. So the implants only stabilize the bone in the area of the implants. And that would be called an overdenture. You can go so far as to have what we single implant replacement, where you would do anywhere between 12 to 14 implants, or maybe 10 to 14 implants. And on those implants, now you have individual crowns or bridges. So this is actually kind of the Cadillac of what implants can do. At the end of the day with this, when it's all done, you would look and feel and be as close to having your natural teeth as possible, because we're able to do crowns and bridges of the exact same size and shape. So this is a long-term solution. This is the best. If time and money aren't an issue, this is by far the best. But that's not usually the case. Time and money are an issue. The problem with this scenario is that it can take a long time. It can take up to 2 years before we're done. In the cases that I've done, a couple of them have taken that long from beginning to end. So it's a very time-consuming process. It's also extremely expensive. This particular procedure, if you're doing the top and the bottom, can get up closer to $100,000 before you're all said and done. So it makes it really unaffordable the majority of the time. And because of the time commitment and the cost, we don't see this a lot in the dental space. However, you need to understand that it is an option. Some people ask, why does it take so long? Well, if you look in this diagram, you can see that all those implants are perfectly parallel and perfectly straight. But we don't always have the bone to do that. And if we don't have the bone to do that, then we have to grow bone. And if we have to grow bone, that takes time. It increases the likelihood of complications, and so we have issues with that. So time consuming and cost, but if time and money aren't an issue, this is the best of the best. What you're going to see more of, and you probably heard more of out there lately with TV and advertisement, radio, and you're seeing it all over the place, is what we call hybrid option. You may have heard of it as all on 4 or all on X or an all on implants. There's a lot of different names for this process. You may have heard of teeth in a day. That's what this is referring to. And what this concept is you're missing teeth or you're going to miss your teeth, you come in, the teeth are removed, the implants are placed, and the hybrid denture is bolted on immediately. So you literally get your teeth in a day. And that's a little misleading. I'll explain that. But the beauty of this, we stop bone loss. You don't have to worry about cavities. You have something that's not removable. This isn't coming out. You can't take it out. We can go in there and take it out if needed, but you don't take it out. It's more than half the fee of the other option that I referred to, so the cost goes way down. The beauty of it, we use a zirconium process, which a material that looks incredibly beautiful. It's natural looking. It's incredibly strong, and so this is the best value in dentistry that we have for when you're missing teeth, missing all your teeth, or going to be missing all your teeth. The cons of this are there is some time involved in it. It usually takes a couple weeks before we're up and running and getting it going for the surgery. You will be on a softer diet with this because as the implants are healing, we can't be moving them and you eating a real hard, crunchy, hard diet. So the softer diet for a couple months with this is a con. But keep in mind with this, I mentioned the teeth in the day is kind of misleading, and people need to understand that the teeth in the day concept means that you walk out that day with teeth, and you do. Those teeth are made in an acrylic material that is what we call your test drive. And in our office, it's a test drive because it allows you then to see, do you like the way it looks? Do you like the way it feels? Do you like the way you're chewing and eating? Once the implants heal, we transfer you then into your permanent teeth. And your permanent teeth is made out of the zirconium usually, which is the all porcelain material that gives us the strength. So teeth in a day, yes, it's not the final teeth in the day. And out there in the media and all that stuff, when you're hearing that, you need to keep in mind that it isn't the final. You need to be getting a more permanent set of teeth wherever you go. So in this particular case, we did a combination. So the picture is a little dark. I apologize. The upper is what you're seeing is the client when they came in the office. The upper is a denture. And the lower, you can see they have a back tooth way back there, and they've got some front teeth right there in the front, but they're missing everything else. And so in this particular case, we did a combination of a hybrid denture on top with implant bridges on each side on the lower. This picture shows you what a temporary hybrid looks like. The holes that you see there are access holes where we can bolt it on and off. In this particular case, we did 7 implants. And so you'll see a lot out there with all on 4, it means 4 implants. In our offices, we don't charge extra for more implants. And if we can, we want to put more implants in there. And the reason for that is that the all-on-4 concept works really well. It's like a table. You have 4 legs to a table. The problem with the 4 legs to a table is that, and the strength that you get with those 4 legs is for some reason an implant fails, now you have 3 legs and you no longer have a table. If we can get more implants in there, then if for some reason you lose an implant, you still have multiple legs to this table. So in this particular case, they have 7 legs. So just an idea that show you that we try to put more implants in. There's no additional charge for that. We just want to reassure you and us that we've got a really strong system. So this is the lower of that case that we were just looking at. You can see we put porcelain crowns on the front teeth, and on the sides, the right and left sides, you can see the porcelain bridges that are permanently fixed to implants on each side. And the top now you can see is the hybrid. And so you can look at the gum, the profile of the teeth coming out of that zirconium. It looks completely natural. It's incredibly strong. And with the top and bottom combo case like this person will have many years of not only a beautiful smile, but be able to chew and eat and function properly. This is an upper and lower case with a patient who came with advanced gum disease, lots of cavities and breakdown, a lot of issues going on with the teeth. But really the biggest issue with him was the insecurity, the lack of confidence. He was in a great occupation. He was around people all the time, and he just could not smile. And he had a really big fear of being at the dentist. And so we treatment planned him together, walked through different options, and he decided on the upper and lower hybrid. So at the time of surgery, we're going to remove the teeth, place the implants, and he's going to walk out with teeth. 4 to 6 months later, he'll have the porcelain teeth on, and there you go. So this is the final result. So now you have an incredible smile, and this person is now able to chew and eat the foods he wants, but more importantly, his social status and his ability to smile, his ability to gauge others and have confidence has just been blown through the roof. So this is an incredible reason, or incredible case to explain how this literally will change people's lives. It's pretty exciting stuff. And there's his life-changing smile. So are you a candidate? We've gone through the different areas now. Let's just kind of go over some of the logistics of it. The good news is for you is that in the majority of the time, 98% of the time, you are a candidate. There's only a few factors that would keep you, if uncontrolled diabetes, HIV, or if you're pregnant, you're not a candidate. Pregnancy, while you're pregnant, you're not a candidate. Uncontrolled diabetes and HIV. Smoking does put us at a bigger risk, so we tend to try to steer away if you're a heavy smoker. There's a lot more things that we'll have to do to make sure that you heal properly and stay. But regardless of the age is really not a factor. So a lot of people think they're too old. You're never too old for implants. How long does an implant take? It really will depend on the procedure, what we're doing, how much bone we have, how many implants we're doing, if we're taking teeth out at the time. A lot of those play a factor. If you were just coming in and we were going to place an implant, the actual procedure to place the implant only takes about 15, 20 minutes. But there's other things that go along into that. If we're doing a big case where we're extracting a lot of teeth and doing a lot of implants, then usually you'll be here for several hours. We usually will sedate for that. So you come in and you'll go to sleep, take a little nap. When you wake up, it's all done. Your smile is done. You have a beautiful smile. The healing time really changes well depending on where we're putting the implants. Again, we spoke to this earlier, and it's super important. Again, 98% success rate after 10 years. The most successful thing that we do in dentistry, bar none. So, as opposed to crowning a tooth or getting an implant with a crown, the implant with a crown is going to be more successful in the long term. Do they fail? Yes, they do. So implants fail just like everything else. I wish we could say that it was a foolproof and there was no failure rate, but there is a failure rate, and there's multiple reasons for that. The biggest one in this list is that 5 to 10% of the failures, we don't have any reason why they failed. The body rejects it for one reason or another. We get soft tissue growing up around it instead of bone tissue. So there's really not a reason that we can pinpoint. But too much pressure during chewing, it gets infected, you're not cleaning, you're not following the rules, you got uncontrolled diabetes, you're a heavy smoker, all of those contribute to failures when we do see them. Do you have to maintain them? You do. You still have to clean them. They're just like teeth in the fact that they can get gum disease, the bone can get infected. You don't want to lose bone around that implant. So, you're going to be on a recommended re-care appointment with your hygienist, making sure that we're keeping the implants clean. It depends. If you have all implants and no teeth, you might be 6 months or even a year on a re-care cycle, depending on how well you're taking care of them at home. You don't need to be in as much as if you had all your teeth. It's still really important to understand that even with implants, there's a lot the hygienists and the dentists are doing when you come in. We're not just looking at teeth. We're evaluating the soft tissue, looking for oral cancer, which is on the rise. There's a lot of things that are being done to help you. Over time, people at home are not able to clean at the level that the hygienist can. So it's really important that at least once a year with implants, you're getting them clean. If you have teeth with the implants, then you'll probably be on a regular basis. Do they hurt? I don't have one, but majority of people that we use or do implants on say it's like having a tooth removed, a little sore. Most of the time we just do it with local anesthetic. So if you're coming in for one implant, we just get that area numb. There's some vibration, some pressure, but other than that, there's really no pain. Most of the post-operative pain that you have afterwards, the soreness will be there, usually controlled with over-the-counter medication. We don't need any crazy stuff to control the pain because it's just usually a small little dull ache. What's the investment? A great question on the investment. Everybody's concerned, and that goes all over the place. We do have specials in place at Burns Dentistry to keep those costs way down, but every case is really dependent on how much bone we have. Is there physical limitations of where we're going to be placing them? Is there sinuses in the way? Is there a nerve in the way? So all of those things are worked through and gone over with you. We like to involve you. You'll walk through your CT scan and your x-rays, the photographs that we take. We'll make sure that you understand everything that's going on. But so to give a single cost for an implant is kind of hard. It's really dependent on your individual case. So the steps, the first step, anywhere that you would go, it's highly recommended that you really have a very thorough, comprehensive exam. The last thing you want to do is pop in someplace and just have one implant placed in an area without really looking at the big picture, because a ton of stuff has to go into this. Aesthetics are a concern. Function is a concern, meaning how you chew, how you bite, the jaw, the muscles, how all those work. All of those things have an impact on implants or any of the restorative options that you have. So a really good comprehensive exam is super important. We'll gather all of those records. We'll take some CT scans of your jaw. We'll take some models, and then we'll sit down with you and create a personalized treatment plan. And that's also really important. One size does not fit all. You need to know your options. You need to be able to make educated decisions given your given circumstances. And so we sit down together and walk you through what your options are, what the cost structure looks like, what the time commitment looks like, what you can expect for every option, so you can feel confident in whatever decision you're making. Then obviously you would do the procedures next. And so once we have that plan, we move forward with the procedure. Once everything's healed, you can celebrate with your new smile. You know, we talked a lot about it. It's an incredible thing that we're able to do in dentistry today. Implants have revolutionized the dental industry. People are able to talk, laugh, eat comfortably, eat the foods they need, get the nutrition that they need, have a very long-term, which I think is hugely important, solution to things that in the past were never long-term. As much as we would like to see some of the things that we do last forever, they just don't. The body just breaks down over time, and implants are really changing that. And so, you know, the biggest complaint that we hear with people that do implants is in our office is that they wish they would have done it sooner. And again, this is another life-changing story that's just an amazing, his biggest issue was not being able to eat pizza. And, you know, once we restored his mouth with implants, he was able to eat the foods that he just missed his whole life. And so, you know, it's hugely impactful, and it's why we do what we do. I want to thank you guys for joining, and as a bonus, we are offering this out. Since you've joined this, you call in, say that you've watched this. So $444 value, you get the CT scan, you get the comprehensive exam, which is very comprehensive. But more importantly, you'll get the consult. And the consult is where the doctor will sit down with you individually, walk you through your whole mouth, walk you through everything that we see, and really kind of lay out the groundworks and all the options for the things that you can do. That's absolutely free. So $444 value. I think it's actually more than that with the consult, because the consult's very in-depth that I think is priceless. We also have another special going on right now for the hybrid special, which is $16,999. This is a limited time. This is huge. This is normally about $10,000 off the price. So this is a steal. It includes all of those things you see listed on the other side, which normally a lot of offices will ding you with later. All of that's included. So we're not increasing for any of those things. All of that stuff's included in the price. It's a no-brainer. If this is an option for you, this is a no-brainer as far as the best value you can possibly get. So thank you so much for attending. We appreciate your time. We have the numbers and addresses down below. If you have any questions at all, we do offer free consultations. If you just want to come in, meet one of the surgeons, one of the doctors, kind of see, get a feel for the office, free tours. We would love to see you here. Again, thank you all for attending, and I hope to see you all really, really soon. Bye-bye.